Hello everyone, in this video we will be talking about some introductory part about stages, various stages of labor, our definition and basic thing, and from next video we will discuss about these all of the stages in detail. So what is mean by in the conventionally the event of labor are divided into three stages. That is first stage, first stage start from the onset of labor, onset of true labor to and it end with the full dilatation of cervix, and it is in other words the cervical stage of labor, and its average duration is 12 hours according to WHO in primary gravida and 6 hours, and according to WHO it is 10 hour in multipara. In second stage, the second stage starts from the full dilatation of cervix and it ends with the expulsion of fetus from the birth canal, and it has got two phases. Namely the propulsive or passive phase. It starts from full dilatation up to the descent of the presenting part to the pelvic floor, and the second is the expulsive or active phase, and it is distinguished by the maternal bearing down effect and ends with the delivery of the baby. So propulsive or passive phase and expulsive and the active phase, and its average duration is 2 hours according to WHO. It is 3 hours in primary gravida and 30 minutes in multipara, and according to WHO it is 2 hours in multipara. In third stage of the labor means that it begins after the expulsion of fetus and ends with the expulsion of placenta and the membranes after birth. It is also known as after birth, and it is 15 minutes in both primary gravida as well as multipara, and the duration is however reduced to 5 minutes in the active management. And there is additional, we have something called as fourth stage. It is a stage of observation for at least 1 hour. It is not the actual delivery process, but it is a stage of observation for at least 1 hour after the expulsion of after birth, that is expulsion of placenta and membrane. And during this period the maternal vitals, uterine contraction and any vaginal bleeding are monitored. Baby is examined, and these are done to ensure that both the baby and mother are well.